My name is Abdul Hamid Nazardin. I'm the Vice President of CORUM. CORUM is the Colorectal Cancer Survivorship Association in Malaysia. Acronym of that is CORUM. I'm going to skip a couple of slides because I think the couple of slides are repeating what the others have mentioned. So I'm going to go straight into what CORUM does. Can I use this and go to that? Okay. All right, sorry. CORUM. CORUM was registered with the Registrar of Societies in August 2013. And last year we celebrated our 10th year anniversary. Its association is an NGO with a total membership of around 700 people. And our main members comprises of cancer patients, survivors like me, and also caregivers. Because we feel that caregivers play a very important role in trying to manage the cancer of a patient. So we have cancer patients, we have caregivers. We also have within our organization medical and allied health professionals. We think that it's important to get them involved because they will be the best persons to give us advice on any medical and health related issue. We can give patients as an NGO the moral support, guidance, but when it comes to a question on medical, we get the medical officers because they are the best persons, they are the experts to give advice. And of course, we have a lot of supporters who are neither cancer patients, who are neither caregivers, who are neither survivors, but they are passionate about this, wanting to help cancer patients. So we have a number of supporters, also members of our organization. Mission is just like any one of the other NGOs, is that we want to manage a group of people with the intention of to improve the quality of life, by providing psychosocial support and information to patients, families, and caregivers, as well as raising awareness. Now, awareness is very important. The word awareness is very important because if you notice, in Malaysia, there's a very big shortage or there's a lack of awareness of a particular cancer. No, especially colorectal cancer, which is the second highest cancer currently in Malaysia and the highest among males. But there's very little awareness on this cancer. So one of the main things that we want to try and do is to create awareness and early detection. Objective, as I said earlier, improve the quality of life of those affected by colorectal cancer. Offer support, advice, and organize. This is quite standard of all the NGOs that you have heard today. We want to improve the quality of life of people who are affected by cancer. We want to provide them support. We want to provide them guidance, and educate the public. That's very important. Educating the public on prevention, early detection, and treatment of colorectal cancer. Colorectal cancer rears its ugly head, many cases when you're in stage 3 or stage 4. Because it's a very silent thing. So it is very important to be aware of what are the symptoms of colorectal cancer. This is what we do. We go out, we do a lot of outreach programs. We go to many cities in Malaysia. We tell these people that there is a need for you to be aware and have in terms of early detection of this disease. Some of the symptoms: a lot of air in the stomach, diarrhea, blood in the stools. These are the 3 main symptoms. If you have any one of this constantly or persistently, you should do something about it. What is the role of the survivors in the psychosocial support? We undertake support sessions in hospitals, mainly in government, both in government and public hospitals. We have a group of volunteers whose role is to go into the hospitals, meet the patients, those who are about to go into the operation to remove the cancer, or those who have already undergone cancer, and we give them support, guidance, and tell them, look, don't worry, this is what is going to happen, it will be passed, everything will pass through. And we are also currently in the process of setting up chapters in other states, because CORUM is primarily located in Kuala Lumpur, or in the state of Selangor, but that cancer can happen anywhere. So we are setting up chapters in Penang, in Ipoh, in Perak, and we are also looking at East Malaysia, Sabah and Sarawak, because there's a lot of cases that go undetected in those states. And we have virtual and face-to-face sessions to try and get people to understand more regarding this disease. We do outreach programs, as I mentioned. We do outreach programs mainly in Ipoh, Penang, and other locations in Kuala Lumpur or the Klang Valley. We do a lot of public forums and webinars where we invite subject matter experts to talk about a certain subject and give advice and give opportunities to people to ask questions and get their doubts cleared. We do screening. As I said, one of the key elements of detecting colorectal cancer is early screening. And there is a special tool called IFOBT, which is basically you take your stool and check whether there's blood in it. If it's positive and there's blood, then we suggest you go and do a colonoscopy. So that's screening, and that helps in early detection. And we have a group of volunteers who sit down and do research on how we can further help patients who are suffering from this disease. I'm sorry, I'm going very fast because I know we're all running short of time. Peer support. This is one of the key activities of CORUM. Peer support. Why do we have peer supporters? Because peer supporters like me, peer survivors, we have gone through the whole journey of getting detected, going to surgery, chemo, and the rehab after this. So we would be in the best position to empathize with a person who is going through that process. We're able to share the experience. With due respect, medical professionals may not have, because we have gone through the whole journey of being under the knife, being cut, take the tumor out, and then the pain that we have to go through and so forth. There is credibility. If I go and see a patient and I tell him, look, I had the same problem that you are having, maybe the patient would be able to listen to me and understand. So that's credibility that we bring along with us. And we build strong relationship with patients. It's very, very important to have a good relationship with patients or people who are going through that journey, and we stay engaged with them. Give them support, advice, guidance on what they should do after the surgery. Just some of our psychosocial support activities. We go and visit patients in hospitals. Yeah, we have. I just wanted to let you know, every Tuesdays and Thursdays, we have sessions on Zoom, where on Tuesday night at 8 p.m., we invite a subject matter expert to talk on a certain subject. And we have about 100 over members who sits down and listen to what that guy. The talks could range from dietitian, financial support, where can we go for financial help? Because, it's going to be expensive. We can have talk about stoma care. We can talk about what does it go through, what is the process of the surgeries. So we get subject matter experts to come and give a talk for about an hour, and the rest of the hour we have opportunities given for question and answers. Then every Thursday is an open forum, every Thursday morning from 10:30 to 1 p.m. on webinar, on Zoom. People dial in, they tell us their problems. We have a group of volunteers, myself and a few other people. We try and answer the questions, as long as it's not medically related. If they ask us whether we can change medicines, we tell them, go and ask your doctor, don't ask us, because that's sensitive. And we have sessions, group sharing sessions. We organize group sharing sessions where we have people who have undergone or gone through the process, sitting down, talking with others who are facing similar situations. Gap, inconsistency is there in terms of the face-to-face referrals, and occasionally this leads to absence of patient referrals, accessibility, insufficient proactive referrals, and over-relying on single doctor for referral. I'm out of time. Recommendation, I think there should be more planning and implementation of a program that requires a lot of time and effort and commitment. I think CORUM is made up purely of volunteers. And that's the biggest challenge I think almost all NGOs are facing today, to have resources who are willing to commit their time and who are passionate in wanting to help. That's a big challenge that we have in this country. Stakeholder collaboration plays an important role. Who are the stakeholders? The doctors, the hospitals, the nurses, stomach care nurses. They play a big role, and they have to come on board. If you don't have them on board, there's a problem. Barriers. We have to get commitments from others to achieve our objective. Financially or non-financially, we are dependent on others as well. So I think the rest you can read yourself. If anybody wants to know more, I don't know whether you can get a copy of this presentation. Yeah? I consent to share it. If anybody wants to read more about my presentation, because I know we are running out of time. It's already 5 in the evening on a Saturday evening, 5 p.m. You can contact NCSM. They'll be more than glad to probably give the presentation to you. Yeah? And we can be contacted at info@corum.com.my. This is our email address. So if anybody wants any information, can send an email to this address and we will revert to you. Thank you. Any questions? I did it in 10 minutes? Okay. No questions? That's nice. Thank you. Thank you very much.